Well, hello, everybody. Welcome to Week 11 of the NFL season. I'm Shannon O'Kelley, physical therapist, and he is Dr. Chris Hawkins, orthopedic surgeon, sports medicine specialist, and we're here to talk about your NFL player, particularly if you're a fantasy football player. We want to describe maybe last week or who's injured and who may start or who may needs to sit coming up. Again, we're talking about Week 11. Let's get started. You ready, Dr. Hawkins?
Yes, sir. We're excited, and then we're getting into that home stretch of the year when everybody gets excited, and we'll find out if our favorite teams can pull it off and make the playoffs.
This is the run. Week 11, total 18 weeks. So you're exactly right. Home stretch, over the hump, halfway there. Keenan Allen, wide receiver, Los Angeles Chargers. He's got a shoulder problem. Looks like let's see what's going on. He had 11 catches for 14 yards. 11 catches for 175 yards and 2 touchdowns. But he didn't practice. This was against the Lions last week. Did not practice this week on Wednesday. Boy, I don't know. Sit or start? What do you think?
Yeah, so if you caught that game, that was a real back and forth game for a little while, and he got sort of dragged down. He's a big receiver, and he got dragged down directly onto the lateral aspect of his shoulder with his elbow down at his side. So he had been killing him to that point. He actually then came out of the game and was actually out for I think about another quarter, and then they brought him back in again. So his mechanism of injury, he ended up with one of those acromioclavicular joint, those AC sprains.
Oh yeah.
And as we've talked about a few times in the past, that's a pretty painful injury depending upon how you use your arms and what you do with them. So he was able to return to that game. He did play. I think we're looking at they're just resting it. They're not describing any injured reserve time or any concern that he's going to be out multiple weeks. So we would assume this is a grade 1 injury, sort of a bruise or a contusion to that joint. And I think they're just sitting him this week to let it rest with the idea that he will be playing. And he is such a prolific scorer in fantasy that I would definitely play him this week.
Start him. You're going to start Keenan Allen, wide receiver, Los Angeles Chargers. They are going up against this Sunday. They're going up against the Packers, it looks like, and they got beat last week by the Lions, and they're kind of a 500 team right now. But I would agree he's going to start. They need him, and fantasy football needs him. Next player, Garrett Wilson. This guy is he's a great receiver. Wide receiver, New York Jets. I saw this Monday night game. The Raiders actually have won 2 games back-to-back with a coaching change there. Garrett Wilson is a big part of the New York Jets wide receiver core. He looked like he got his elbow bumped, and he was on the sidelines. They were doing some evaluation, but he played 14 targets for 93 yards, but they lost to the Raiders. Start or sit this weekend. Garrett Wilson, second-year wide receiver, right? He's pretty young.
Yep. Yeah, so he's a speedster. He's really done really well for them when he's been able to get open and catch a lot of balls. He's got really great yards after the catch ability as well. He ended up with basically an elbow sprain. So essentially what he had is, I think his initial injury when he came down was sort of like bracing himself, and so probably partially hyperextended that injury, but then he kept playing and took some other blows up against it. He will be a start this week. They'll definitely. He's a young guy. He doesn't really need to use his elbow per se to do anything like block or anything like that. So we anticipate that he'll be starting.
Okay, there you go. Garrett Wilson is going to start. Mike Evans, wide receiver, Tampa Bay Buccaneers. I think I read where Evans is on pace for his 10th consecutive 1,000-yard season. He's been hampered by a little quadricep injury. I think it's going back since the season started. This is one of these soft tissue injuries we've talked about off and on during our podcast here, but these things can linger. He had limited practice on Wednesday with his quadricep. Just start or sit. What do you think?
Yeah, he's the classic, getting a little bit older wide receiver. He's a big body, so his ability to kind of come back is going to get hampered. And you brought up those lingering things. He's been fighting a couple different areas. I think initially he was having some groin problems, and then it was hamstring, and now quadriceps. And he's probably one of those guys who's kind of gutting it out. He's been having a good year. He seems to be hitting it off well with Baker Mayfield. And I think he's just one of those guys that are going to limit him in practice to just take the extra mileage off of his body and let him recover. But he'll be a start, and he's been so productive this year. I think you keep him in your lineup for sure.
I agree 100%. Mike Evans, wide receiver, Tampa Bay Buccaneers, is a start. Our next player here. I think we've talked about Puka Nacua, wide receiver. A lot of wide receivers here. All the players so far have been wide receivers. That's a big job. That's a kind of a dangerous job, going over the middle, getting hit like that when you're not able to protect your body because you're going up for the ball. But Puka Nacua, wide receiver, he has an injury going back to week 8, and I think they're limiting him this week in practice, looking for week 11 with a swollen knee, and a little banged up the last couple of weeks. What do we think here with Puka Nacua? I like that name, wide receiver.
Yeah, excellent. I believe he's a BYU product.
Oh, yeah.
So, yeah, he's been on fire this year. He's had this sort of recurrent swelling in his knee, and so for the people listening, we call that an effusion, and so that's a sign that there's some low-level inflammation in that joint. He's an NFL player, so that they've done MRI imaging on him, and obviously haven't found any major structural damage, such as like meniscus or ligament damage, but this tells us that somehow he's caused some low-level inflammation, and all this activity that's running around, it's not kind of calming down. So I think he's just one of those guys that they're going to use him. They will play him. He probably, with Cooper Kupp coming back, has obviously not been as productive in that offense, but I think he is also a start and has that potential to still produce well as a fantasy player.
Yeah, he's a play. I would agree. He's going to be a play, and he's going to be able to produce. You're right, though. You're exactly right. When Cooper Kupp was on the injured reserve, he was very important, and he that was good for him. I think that was good for Puka's career at that time because he was on fire and probably still going to be great, but he's going to play. All right? Good deal.
Yep.
Here we go. I want to talk about you real quick. Let me ask you a question of our listeners, particularly. You talk about this knee effusion, this swelling. Sometimes we refer to as a synovitis. Maybe you can describe the synovial lining just to get into some anatomy, physiology here, because I think the body is fascinating. But that synovial lining, sometimes if it's stretched, irritated, banged up, it kind of gets hyperactive with that fluid production, that synovial fluid, and that sometimes it can create that swollen knee. Can you talk about that a little bit?
Yeah, the thing I like to tell patients, because it's a really easy analogy, is if you get a little bit of sand in your eye, you start to tear up, you start to water, and so that's very analogous to what happens inside the joint. So that tissue is very vascular that lines the joint, and it normally produces fluid that provides lubrication. And so again, if there's something that's a stimulus to that, and it can be trauma, it can be injury. It can also be just, chronic autoimmune issues. So we have patients, that have like rheumatoid arthritis and have significant swelling in the joints as a result of it. But that affects everything. So when you get fluid in the joint, that affects obviously the ability of the muscles around it to contract and to control things. And so again, another analogy is if you've got a really swollen knee and you're doing things on it, you don't have as stable of a joint. It's kind of like walking on a surface that has a little more give to it as opposed to a firm surface. You're going to have a little bit of shifting and a little bit harder time controlling things. So you're prone to hurting the joint above or below, in compensating, or obviously overstressing the joint itself. So, at these high level, that's why, a lot of times they wonder, well, he's got a little swelling. Why isn't he playing great? Well, because it affects everything.
I mean, it's amazing. The human body, like I said, is just amazing. I mean, what people need to understand, I'm sure most people do, is when you're out there starting, stopping, cutting, twisting, turning on a football field or an ice rink or whatever, basketball court, those muscles are firing and reacting. And what the body is doing from proprioception to turn those muscles on and off is amazing. And exactly, as a physical therapist, that's why we try to reduce the swelling and eliminate the pain as soon as we can, because we know that any muscle that crosses that joint that's inflamed or painful, that joint basically tells those muscles, because they're neighbors, don't fire too fast, don't fire too hard. We're a little bit irritated here. So you got to control that joint pain and inflammation to fire those muscles. That's the whole rehab process. Good stuff. Good stuff. Nico Collins, wide receiver, Houston Texans. One of these calf muscles, kind of, limited practice on Wednesday. Yeah, he's, Houston Texans, on fire right now, really coming out of the hole, looking good. C.J. Stroud is just amazing as a rookie quarterback. What do we think here?
Yeah, that sounds like our classic sort of gastroc strain or gastroc tear injury. So above the level of the Achilles, so not something that surgically needs to be treated, but it's one of those ones that there's degrees of injury, degrees of tearing in the muscle. He has been able to practice, so obviously we're probably thinking this is just a grade 1 injury. And he generally, he's a wide receiver who has to plant and twist and pivot, and so those more explosive motions are what puts him at risk of coming out. So I would generally look at his situation. I don't believe he's been a huge producer for them, even though they've been doing much better as a team overall this year with C.J. Stroud as their quarterback. So I think he will get the chance to play. I think he will start. But if we back it up to the fantasy level, I think I might be a little reluctant to put him in my lineup because I don't think he will get as much work as he would if he were healthy.
Yeah. It sounds like that's probably a pretty good assessment. It sounds like he is going to play. It's not a significant calf injury, but he might not be super productive for your fantasy team. So keep an eye on that. Good stuff here. Last one here. I want to spend a little time on this one. This guy, Deshaun Watson, quarterback, Cleveland Browns. They beat the Ravens last weekend, and they beat him because, if I remember, Deshaun Watson ran for some yardage to put him in field goal range. There was like 4 or 5 games last Sunday in the NFL that were won by field goals in the last 5-10 seconds, and the Cleveland Browns beat the Ravens. That's pretty impressive. But this quarterback has been out a little bit. He's had some injuries early on in the season. We talked about him. He had a high ankle sprain in that game against the Ravens. He played, but then they went to do an MRI of his right shoulder, i.e. his throwing shoulder, and lo and behold, he has a fracture of his glenoid. I think we need to spend some time here talking about this because it sounds like he is potentially done for the season.
Yeah, so he was obviously struggling with a problem in his throwing shoulder and had this thing imaged several times leading up to this. So they really have that ability after this recent injury to kind of know that it's a new problem. So essentially the glenoid or the socket of the shoulder is kind of like the top of a golf tee. Mm-hmm. What they found is that the edge of the golf tee had a small crack in it. And that usually happens when there's been a situation where the ball of the shoulder has been forced onto the edge of the socket. Obviously if it dislocates, that can happen, mm-hmm. but he didn't actually do that. So we're assuming it was just a compression injury. Now, the problem is if you go out and try to play in that type of a situation with that type of an injury, there's a high likelihood that fracture is going to displace and or he's going to dislocate the shoulder joint and cause further damage. So I think they're looking at it. I bet it's a non-displaced fracture, but they feel that needs to be fixed and stabilized so that he can, rehab it, strengthen it, and have a shoulder that's not going to be a problem for him in the future.
Yeah, it sounds like, if they're going to do that, that's a season ending. It needs to be done now, and he's out for the season. That's what I'm picking up.
Yeah, I believe he is going in for surgery. If not this week, then next week.
That's what I
fixed. He'll be done. Yeah,
let's talk about this because if I remember right, probably 4 or 5 weeks ago, I don't know. I remember he took himself out of a game. He warmed up, and I think he told the coaching staff he just didn't feel right, and it was right side. It was his throwing arm. Am I remembering this right? And
yeah, exactly. And that's they imaged him with an MRI and at the time, and his diagnosis was that he had a strain.
Yes.
Of his subscapulary.
Yes. It was they thought it was soft tissue, like a kind of rotator cuff irritation, right? And I'm wondering if these sometimes, because these fractures, if they're just minimal or they're hairline or whatever, is it not uncommon for an MRI not to pick that hairline fracture up? Maybe potentially. I mean, how sophisticated are MRIs with fractures?
Yeah, I would think they've got a pretty good handle on that with the size of the machines they use now.
Yeah.
What you may see, if it's an old fracture, sometimes a small crack, those won't show up very well. But usually what you'll see now with those acute injuries is there'll be a lot of edema or, sort of increased water content in the bone with an acute injury. And so I think it may have predisposed him because of some rotator cuff weakness, perhaps, because your rotator cuff helps stabilize things. But I'm pretty sure that they probably would have picked up if there had been a small fracture ahead of time. I think it just was bad luck.
Yeah, it sounds like it's bad luck. I mean, he was off for like one or two seasons, and he got back in the league. He actually has been looking pretty good. The Browns are doing well. I mean, he's a big part of their offense, or look like they beat the Ravens, for gosh sakes. But here's the deal. As we wrap up here, you talk about the golf tee, the glenoid fossa. The glenoid fossa is the socket that the ball of the humerus sits in. If that is fractured, you're talking about articulation. Is this a articulation thing, or is it outside the articulation? And what do you put wire in there? Do you put screws in there? What do you do? How are you going to repair that fracture?
It all depends on the size.
Yeah.
So you can have a sort of a small sliver of bone, which basically means that you've sort of lost the anchor for the soft tissue that stabilizes things. And if that's a small sliver, you can put that back on arthroscopically with small anchors in the bone and sutures. If that size of that piece gets larger, maybe say 20 or 25% of the surface area of the glenoid, the socket, then it's big enough that you would consider like actually putting screws in that would compress it and hold it in place. And that's generally, there are some pretty slick guys that are starting to figure out ways to do that with arthroscopic assistance.
Yeah.
But generally, once you put screws in, oftentimes that's an open procedure. And again, if they end up needing to do that in a throwing athlete, I think there's big concerns about getting back their flexibility to be able to throw as well as they did down the line. So he will do much better in the long run if this is something that can be addressed arthroscopically as opposed to open.
That arthroscopically, arthroscopes have changed the world of sports medicine and medicine in general. I mean, it's just amazing what you're able to do, minimally invasive, and the return and the start of rehab that people can experience and get back to activity a lot faster with this minimally invasive surgery. But it's interesting because, I'm just, as we wrap up here, those screws that you're talking about, I understand they've developed, or that you guys use as orthopedic surgeons. Do you use screws that are what they call biodegradable? I mean, you can use them to anchor it, and the body reabsorbs that material. Is that being used in cases?
You can use them in certain situations. So with regards to, say, the anchors in the bone, if this is something you can do arthroscopically, it's very common to use things like that. When you get into larger plates and screws where you really need to compress the bone together, we generally do not use those as biocomposite materials because two reasons. One is their actual functioning strength, meaning their ability to break and stuff, is not as good. And if the bone doesn't heal, they leave a void in their place when over time. So yeah, we don't generally use absorbable screws to hold bones together. We use them for fixation to hold soft tissue in place more commonly.
I love doing this with you. I love this Starter Fit podcast with Dr. Christopher Hawkins. I mean, it's awesome. I mean, you know the injury, you know the return, you know the starter sit, but you can also talk about what these athletes are going to be experiencing if they do have surgical intervention. So great doing this with you. Here we are wrapping up what going into week 11, and we'll see everybody next week for for our Starter Set podcast. Same time, same place. Thank you.